Now, another thing I think that's especially important when we're working with suicidal individuals is we're also going to want to make sure we're attending to risk. More specifically, what I mean by that is we're going to want to make sure we're getting an understanding of what's happening with them in regard to suicidal thinking, non-suicidal self-injury, and whether or not any of those behaviors are occurring. And there's a variety of different ways in which I'm going to do that. Number one is I might just ask those questions. I'm going to be asking about past suicidal thoughts, current suicidal thoughts, past suicide attempts, if there's any current planning. I'm going to be asking about intent. Do they have access to means? And if so, as I'll mention in a little bit, we're also going to be working on removing access to means. And so another thing that I thought could be helpful to you all is to also talk with you a little bit about some of the measures that we often use in assessing for these things. Now, the cool thing is these are actually all available for you free as clinicians through Marshall Lenahan's website at the University of Washington, the Behavioral Research and Therapy Clinics. And we'll include a link here so that you're able to take a look at those things. There's a number of different instruments there, again, that are free of charge and available to you. There's also a number of accompanying articles that further describe that, the statistics that go along with it as well. I thought I might point out to you a couple of instruments that we are regularly using. So one of the instruments that we regularly use in our clinic is called the Suicide Behavior Questionnaire. And this is one of those things that's available through Marcia's lab at the University of Washington. It's a handy instrument, and it's a self-report instrument. So we're asking clients to fill this out generally before the start of treatment to get a better understanding of their history of suicide attempts, their history of self-harming behaviors, their thoughts in regard to suicide now, plans, intentions, and such. And this is very useful for us because what we're doing is we're trying to get a better understanding of what's going on with our clients. Some research has shown that we're really not that good generally in being able to predict whether or not a given client might attempt or die by suicide. Therefore, I think we want to watch out for being overly confident in our ability by just looking at a measure like this to predict accurately what is going to happen with a given individual, but it's going to give us some ideas. It's also going to be very helpful in treatment planning, safety planning. And so I do need to know what's going on with my client in regard to some of these items so that I can figure out what parts I'm going to need to attend to and how much time and effort we're going to make sure we devote to just that. Another instrument that's there that I find is very helpful and something that I'm regularly using as a clinician is called the Lenahan Risk Assessment and Management Protocol. It's called the LRAMP in short. And what this is an instrument for me as a clinician to fill out. And what it does is it walks through some of the risk factors associated with suicide. It also walks through some of the protective factors. And then finally, what it does is it helps us document why we're deciding to do what we do. Let's say I've got a client who I'm thinking is at least moderate risk of suicide, and I'm deciding we're not going to send them to the hospital. If I want to be able to explain why it is I'm doing what I'm doing, that form is going to be useful. And so this is really handy, not only in helping me further consider the client's risk, but it's also helpful in documenting and demonstrating why I did what I did. And that, I think, can be, of course, very helpful for us as clinicians in terms of protecting ourselves by showing that we are providing a reasonable standard of care. The final instrument that we're going to be using is actually a central component of dialectical behavior therapy, and that is the diary card. And that's one other thing that's available at that website. And so this is important because this is an instrument that I'm going to ask the client to fill out each week, daily. And what it does is it provides the client with an opportunity to track the intensity of their emotions, their urges, and whether or not they're actually engaging in any suicidal behaviors, whether or not for some they're engaging in any self-harming behaviors on a day-by-day basis. And so this is something, again, that I'm going to orient the client to early on, and then I'm going to be beginning each session with. It's good to see you. Do you have your diary card? And this is what's going to help me know whether or not I'm needing to attend to suicidal behaviors in a given session, because they're going to be indicating and or tracking what's happening with their urges and or the actions each day. Now, of course, we're going to run into troubles with that, and I think dealing with that could be a whole separate workshop. But one of the things that I will do is if my client has not done it by the time they make it in for session, I'm going to give them a blank copy and ask them to fill one out as best they can right there. And then from there, we're going to address it just like we would any other therapy interfering behavior, which is try to get better understanding of what happened and got in the way of them doing so. And then, of course, from there, we're going to be considering and trying to come up with some other solutions.